And this was a good one. What type of bra is best to use while nursing? And any recommendations on a sports bra for moms going back to the gym?
Right. So with regards to bras, we want to avoid underwire. We want our bras to be supportive, but not restrictive. Because if we have anything that's kind of digging into the breast tissue, it's going to hinder the way the milk is flowing. That's where we lead to plugged ducts, which could lead to the dreaded mastitis infection. So again, support is wonderful. It's summer. It is about 110 degrees outside. It's humid, right? We're in Florida right now. So I would also suggest that anytime you're outside and you've been, sweating, to come inside and change that as soon as you possibly can. Okay. Having really good hygiene with that, so that if there was any breakdown in your nipple, you just don't want bacteria to have a chance to enter in. So changing often is a good thing. But cotton bras, no underwire, supportive, just not restrictive.
And that's the same for the sports bras?
Yeah, it's the same thing.
Okay. Oh, I get this question a lot too. Will squirting breast milk into the baby's eye cure an eye infection?
Well, I guess that depends on what the infection is, right? I love breast milk. I think it's a wonderful thing, as much as anybody else possibly could. If it's something simple like a plugged duct, tear duct, then it potentially would be helpful. It's not going to hurt anything, but I would refer you back to your pediatrician for further evaluation.
Yes, because there are several causes of eye infection, so we want to figure out, is it a true eye infection, a blocked duct, and then kind of advise you from there.
Absolutely.
And when should a mom stop breastfeeding?
Gosh, that's such an individualized question. I can talk about what the recommendations are. For our country in the United States, the American Academy of Pediatrics recommends exclusive breast milk feeding for the first 6 months of life. So does your baby need any rice cereal or water or any other supplements for the first 6 months? If you have a healthy, well newborn that's been a term baby and no other complications, then the answer is no, just breast milk for 6 months. Around 6 months, you can begin introducing complementary solid foods. And again, the American Academy of Pediatrics recommends continuing that for the first year of life, and then as mutually beneficial for mom and baby. The World Health Organization says until 2 or 3 years old at a minimum. So it's very cultural, what is accepted. But as long as you and your baby and your family are happy, then keep going, mama.
Agree. And then what is the best way to wean a baby when mom is ready to wean?
Sure. So I think cutting back one feeding at a time, right? What I hear the most is that the last feeding typically will be either when mom comes home from work and they're just looking for that snuggle time, or that's how they've been getting them to sleep. So it's that last one before bed is the last to go. So just cutting out one at a time, trying to distract, coming up with new routines, maybe some, baby massages, and maybe reading to them, just coming up with a different routine, trying to distract, offering them maybe a new sippy cup, a new straw, something to take that place, and being patient.
Yes, absolutely. And can mom continue to breastfeed once the baby gets teeth?
Absolutely. I know it's scary. You're like, oh my gosh, I'm going to put my breast into this little piranha's mouth. And with that, if they're biting, then they're not nursing, because they have to have their lips, flared out, a nice suction. Those cute baby cheeks are what helps to seal that suction. So if they're biting, they're not feeding anyway. So if they bite, and you react to that, just stop it. Just right then, okay, then this nursing session is over. Take it away from them. Because sometimes they find they think it's a game. And if mommy reacts to it, and it's a big reaction, they might think that's funny. And then they're going to keep doing it to see, what did you do next? So after that initial shock, if you can try not to react and just cut off that session, that's going to be the best first advice that I have, at least.
Exactly. They always just say, stop biting, no biting.
Right.
And they'll pick up on those cues.
Yes, especially if you take away what they want.
Absolutely. This came in recently. Is it safe to purchase breast milk online? So some moms, their supply is dwindling or they're worried about the supply and they want to continue breastfeeding, so they seek to purchase breast milk. Can you advise us on that?
Yes, and I would highly discourage someone from doing that. Quite frankly, you know, when we're purchasing something online, not only do we not know maybe the person who's selling it, what their health status is, we don't even really know if it's breast milk.
Correct.
We don't know what it might be. And even if it is breast milk and it's someone who, you know, is very healthy, we don't know what their storage guidelines were like. How long, when was it really expressed? Was it refrigerated? Was it frozen? How is it being shipped to you? Anytime that something's being sold on a one-on-one basis, especially breast milk for a price, that's a red flag.